Good morning to one and all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today I would like to discuss with you all regarding an important disease entity, what we call as Nash. It's nothing but non-alcoholic steatohepatitis. In case if your liver, if it is going to accumulate by so much of fat, you are going to land up in a condition what is called as fatty liver. And you'll be doing a routine screening in multiple setup, and you're going to check your ultrasound, you can able to identify your fatty liver. Once a patient is going to be having evidence of fatty liver, you need to be very cautious, because this fatty liver may predispose to a condition what is called as Nash. So once a patient, if it is going to involve, so there is high possibility for the patient to land up with evidence of cirrhosis. Once a patient is going to land up with cirrhosis, there is high possibility for the patient to go for liver cancer. Why this condition has happened? As we all know, in India, the main event which is going to affect your liver, which is such a wonderful organ, and the weight of your liver is almost around 1.5 kg, and it does almost around 1000 to 2000 functions, plenty of functions in your human body. It's going to happen because of your liver. Once the liver is going to get affected, you are going to land up with multiple complications like jaundice, you are going to develop cirrhosis, liver cancer, and multiple other complications. Finally, you may land up with end-stage liver disease, or else you may deserve a liver transplantation as early as possible. How to prevent this fatty liver condition? So you need to do good physical activity, because in Indian scenario, the most common etiological focus for you to develop this, even if you're non-alcoholic, if the patient is going to have evidence of obesity, if your BMI, if it is going to be around 25, more than 28 to 30, and if your waist circumference, if it is going to be around 100, more than 100, there is high possibility for you to land up with this kind of fatty liver disease. And if the patient is going to have uncontrolled diabetes, thyroid related disorders, and dyslipidemia, if your cholesterol is not in control level, if you're overweight, if you're sedentary, if you're going to lead a sedentary lifestyle like IT profession, if you're going to sit in one place without doing any physical activity, there is high possibility for you to develop this complication. So do good physical activity. Make sure that your aerobic exercise at least should be around 20 to 30, minimum 30 minutes in a day. Along with that, you need to do good whatever mode if you're practicing, you need to do that. Along with, you need to take care of your diet process, your nutritious diet, avoid plenty of fat in your diet with good physical activity, and follow with your gastroenterologist as early as possible once you're going to develop your fatty liver, to avoid major complications like Nash and other events, which is one of the most common scenario next to your alcoholic liver disease being reported in India. So in order to prevent the complications, in order to prevent the liver related disorders, in order to prevent the liver cirrhosis, in order to prevent the liver cancer, so be very cautious and screen yourself early. There are so much of innovations being happened in the field of hepatology to look in this area of non-alcoholic fatty liver disease. If you want to screen that, so get through your gastroenterologist as early as possible, and focus your nutritious diet process and control your obesity. Then with that, you can able to overcome this complication successfully. Thanking you all for patient listening.